The back part of the brain has areas that control all functions necessary for life. An artery is a blood vessel that carries blood from the heart to the other parts of the body. The back part of the brain is supplied by the basilar artery, which is formed by two arteries joining together. Some patients have more fat in the arteries supplying their brains. A small part of the fat can get removed from its location and travel into the basilar artery and block it and can cause a stroke. A CT scan is done to identify if the blood clot that is blocking the basilar artery can be seen and what damage to the brain has it caused till now. An MRI scan might be done to better identify the area which shows signs of reduced supply and the extent of damage to the brain till now. This is a case of stroke. The patient must be treated urgently to prevent further damage to the brain. At this point, opening the vessel to remove the clot can still help the patient. If we don't remove the clot, the artery will be completely blocked and the part of the brain supplied by this artery will not be able to function anymore. The patient will have severe damage to important parts of the brain that control life. His or her life may be at risk. In order to treat the patient in NIMHANS, we remove the clot to clear the block in the artery through a process called thrombectomy. This will restart the flow to the brain. To remove the block, angiogram of the blocked artery will be done. Then, we will put a catheter till the point where the block is seen and apply negative pressure to remove the clot. During the treatment, we might decide to inject a medicine inside the arteries to dissolve the clot and clear the block in the artery. This process is called intra-arterial thrombolysis. In some patients, the clot cannot be removed by applying negative pressure. In this case, we may try to remove it by using a stent. A stent is a hollow tube that is inserted into a blocked vessel to keep it open. We might also have to leave the stent inside the artery to ensure that it stays open. After the procedure, the patient will need neurological care and will need to be transferred to the neurology ICU or ward. There are certain risks involved in this procedure. During thrombus aspiration, the clot sometimes breaks into smaller pieces, goes to the smaller arteries and may block them. This can cause new neurological deficit to the patient, but this cannot be predicted. Sometimes, the clot may be difficult to remove and then the artery cannot be cleared. By removing the clot, we are trying to prevent further damage to the brain. If there are any complications and the patient develops new deficits, the stay in the ICU or hospital may increase. If the patient has associated cardiac or heart problems that cause the stroke, she or he might need further cardiac care. Since NIMHANS does not have a cardiologist or a cardiology department, the patient will have to be referred to a cardiac specialty hospital. The patient's cardiac status may have a bearing on the final outcome of the treatment. The materials that are used for the procedure are expensive. You will be paying for the materials used, hospital stay, ICU, medicines, etc. You will have to pay 50% of the approximate cost before the procedure, and the rest can be paid later. In case you are eligible for any reimbursement, you may claim it with the bills that we give. If you agree, you must sign a consent form for the procedure. We will discuss all this in detail again with you after the procedure.